All right, so this is just a flat out lie when it comes to vaccinations. The fact that the well visits are strictly there for vaccines and it means for us to profit from vaccines and push them on children. There's a lot more to well visits. And first and foremost, we do give vaccines and they are helpful and valuable in keeping our patients safe. But that is not all we do, and there's a lot more to well visits. And just to give context here, this is how many well visits we give to children. The standard well visit schedule, you can look this up on AAP, is a birth visit, so the first visit right after birth. You do another visit about a week after to make sure the baby's gaining weight. You do another visit at 1 month old. Then you do visits at 2 months, 4 months, and 6 months old. Then you space it out a little bit more. You do visits at 9 months old, 12 months old, and 15 months old. And then you see them at 18 months old. Then you space it out even further. You see them at 2 years old, then 2.5 years old, then 3 years old. And then after that, you see a child annually until they're 21 years old, where they go off to the adult doctor. That is roughly 31 well visits in a child's lifetime from birth to 21. Of those 31 well visits, you give vaccines at 2 months old, 4 months old, and 6 months old. You get a break at 9 months, nothing then. You also give vaccines at 12 months old and 15 months old. Then after that, you give vaccines at 18 months old, which is usually a booster or second dose of the hepatitis A. Then you give vaccines at 4 years old, so there's a big jump and a big gap. And then you give vaccines again at 11 years old, and then you give it at 16 years old and 17 years old. So when you look at the visits that we do vaccines, it's only 10 visits out of 31. So 1/3 of the well visits actually involve vaccines. The other 2/3, which is more than half, has nothing to do with vaccines. We are screening a child's developmental milestones to make sure that they're developing okay. There are no delays. We're screening for autism. We're making sure they're gaining weight and growing. We are making sure that, there are no issues like teenagers, screening them for STDs and drug and alcohol use, screening for mental health. We are screening and checking for so many things in a child, and there's so much more to well visits than just vaccines. And this myth has been scaring parents away from scheduling well visits, and that is not good for a child.